Alright, so I'm going to try to teach you how to do infusions, show you a little bit of my life. We have alcohol prep pads. We have Tegaderm for helping her hold the needles into my belly. We have flow rate, which connects the syringe into your high flow tubing, which that's your needles. And of course your syringes. I get 250 milliliters. I use these nifty little things because they're better than the needles to extract the medication from your medicine bottle. It's not too hard once you get used to it and establish a pattern. You keep your hands and area clean. I have a pad that insurance provides to keep everything sanitary during prep and in between preps. So what we do is real easy. You take your tubing out, and of course your little tubing comes with little Tegaderms, which I use to initially attach the needles into my stomach. And then I cover it with the bigger because sometimes the little ones don't like to stick. This type of infusion is actually for my immune system. It's called Cuvitru. There are many different types of brand names for immunoreplacement therapy. For me, it works quite well. I do take Benadryl, ibuprofen, and Tylenol before I do my infusions to help with pain, any sort of reaction that might occur. What they make immuno replacement with is people's plasma. So whoever donates plasma, you're helping keep me healthier. Helping make my life a little bit easier, a little bit brighter. It's always fun trying to straighten out the tubing. Now this end goes into your syringe, while this end goes into your flow tubing, your needles. And you take the little caps off, and you just connect them. Real simple. Make sure they are tight or they will leak. Now usually when you do this, you will have a nurse to show you, depending on your insurance coverage. They like to anyhow, because, you know, make sure you know what you're doing rather than just instructional videos. But I know a lot of the videos out there, they don't show a lot and they don't give a lot of information. So what you do with your medication, you pop your top off. And when we say keep things sterile, you wash your hands, then you use rubbing alcohol, yeah, that's right. You use hand sanitizer, and you get every surface of your hands. And even though these are capped, you always wash the top. They are sterile, but better safe than sorry. You do not want an infection inside you. And yeah, you rub it for a while. It happens. 15 to 30 seconds. And I have my child over here helping me. My eldest. They are my helper almost every week. My daughter, my youngest, is the helper when he's not. You stick it in. It's a little tough sometimes. And then you unseal one of your syringes. Now sometimes syringes come with a little bit extra air. Always push it out. Now, My tip, a lot of people tell you, go ahead and tilt it. And as you tilt it, you hold it like this. You pull. It's going to be a little harder because it's thick. You pull it back. You will get bubbles. I usually keep a Kleenex on hand to try and when it's over, because you will lose a little bit when you're trying to get all the bubbles out. You can get champagne bubbles. You can either let it rest for a little while. You don't want to let it rest too long because, again, it is severely processed plasma. But you try, as you go down, you see it's starting to go down. You slowly take it out. And it's just a small little trick. And you try and get it out. And it's down as much as possible because this stuff is liquid gold. Now, I am not a paid sponsor, by the way. This is just the brand I use. Your doctor will choose what's best for you. This is just what works for me. I have a trash can sitting on hand. Forgot my Kleenex. Can you please? See, champagne bubbles. They really don't hurt you. And yes, Ash is very sanitized. And you just slowly, just like any other syringe, like you see the nurses do. And usually the big bubbles, if you're really careful, aren't that many. And even if you have a couple of big bubbles, and see, yeah, you see the champagne bubbles in there. They're really not that bad. As long as I've been doing this, which is almost a year now, they haven't really given me any issues. Now, when attaching your tubing to your thing, you do not want to get it on too tight. You get it on too tight, you can't get it off to replace it, because you will need to use the other syringe. You cannot reuse a syringe. Once you do this, this is what we call off to the races, because each tube can oftentimes go at a different rate when you fill the tubes. You do not want to miss this step. You miss the step, you're gonna be in pain. You squeeze, you make sure you have plenty of light, because of the fact that it is very clear and it matches. Hold on, we'll show. Now, it is very difficult to see. And see, it's already in the, what we call the gate. I don't know if you'll be able to see this taking off. Oh, yep, you can see it in there. There you go. Oh, lost focus. Now see, it is very hard to keep track of sometimes. You do not want to let it go past this metal part here, because once it goes into the needle and out the needle, it will cause irritation and stinging, and it's really sticky stuff. You don't want to have to stick a needle in with it like that. Right now, my fluids are right there. And you watch them closely. Now, if one gets close, and I'm going to separate them out. If one gets too close, what I'll do is I'll shut off that particular line. Do we know where they are? Oh, yep, we do. And then it's so thick that it can still go even when you're not pushing it. So I'm going to watch this. I don't know if you can see it. Okay, so one has already gotten there. So I'm going to lock it off. Two of them have. Let me pause. Okay, so locking off is rather simple. I mean, if you've been in the hospital, you know. You just shove that cord into there. Now, we still have a little bit more to go on there. If it hasn't been running, yep, it was running while I was locking off the other two. So I'm just going to lock off the main. Now, each thing has a lock, and then the main has a lock. So, your next step is cleaning and prepping your area. Because I have such a big gut, because I've been sick a long time, and I got big 5 years after from having a severe coli poisoning. And I've been fighting the battle since. So I have a lot of spaces I can go to. I exchange spots. I'll do upper right, upper left, lower right, lower left. This gives the area time to heal, because for me, I have 100 milliliters going into my stomach. Some people will have less, a lot less. My immune system is pretty bad. This is the highest dose you can have for subcutaneous. After that, it's intravenous, which is dangerous for me because I do have kidney issues. I had part of my kidney removed, along with 2 stenomas and a very large cyst. It was bigger than half of a pop can. That's about how much fluid that they measured. They didn't measure all of it, but that's how much they took out when they stopped measuring it. So what your first step is you're going to clean each area as you stick your needle in. You don't just pre-prep. Some people will use numbing gel. I don't. It makes me know whether or not I've hit a nerve or not, because it's going to hurt more if I've hit a nerve, and I need to be prepared for that. A lot of times I'll test the area with my fingernails. You want to look, make sure you do not have any blood veins in the areas or any scarring. If you have any blood veins, you can just miss them by, just close, just don't hit them. If you have scarring, you have to do this in between this and the scar, because the scar tissue will not absorb it, and you'll tend to have backup issues instead. If you do have leakage issues from any of the lines, block one line off and continue on with the rest. If you have too much problems with it, do call the number you are provided by your provider to get the help that you need instantaneously, and block off the main. If you have any allergies, same thing. I'm not a doctor. I'm not a nurse. I'm a patient who has walked this through and through, and am trying to walk with you on your journey. I know the ups and downs. I know how great I can feel on a good dose and how bad I can feel on a bad dose. And I know what to do if things go wrong. Anyhow, again, like with your bottles, you want to rub for 15 to 30 seconds. Get the area clean. Even if you've showered, this is still necessary. And sometimes I lose track and I do it for longer, which that's okay. It gives me time to feel whether or not the spot's going to be a good spot or not. You take your needle. It's a nice little butterfly needle. I can't show you the actual needle because, some sites don't like that. And you just push it in. Now, I like to do a 3 count. 1, 2, 3. And you put your Tegaderm. And there's your first site. Now some of these only do 2 sites. I prefer the 3 because it gets done quicker and it spreads the medicine out. You always start with 3 though. And again, this is information that I hadn't found on a lot of the other videos that I had watched. If you have bruising, the same rule applies. You do not want your medicine too close to that bruise. It will not absorb properly. And it just ends up hurting. One, 2, 3. Now sometimes I've found that the less fat there is, the more it will hurt. But that's just me. I also have fibromyalgia, which is very... things hurt more every time I do it. Another person it might not hurt, but I'm not going to lie. These are needles. They hurt. This is fluid going into your body. Skinny people do it as long as you can pinch and you've got the right type of needle. You can do it. And apparently I'm shedding. Okay. And one last. And I'll show you the device. Yeah. Throw away the right thing. Now I like to try and keep them kind of close together. You don't want them too close. You want to keep them at least 2 fingers apart. Again, roughly 1.5 to 2 inches. Gives the medicine room to spread. But I like to keep them in the same area so that by the time I do my next dosage, that area is healed. I give myself extra time for healing because it does take me a little bit longer to heal, and I've found that if I do not give the extra couple of weeks in between for that area, I will regret it. Which is why we switch sides, is to give your body time to heal. Now, either 1, 2, 3. And throw away the right thing, not the wrong thing. And all lined up and pretty. Yeah, I know. Not very pretty. Now, I do the Tegaderm to make sure that they stay because, like I said, them little ones don't always stay. I always have trouble. Sometimes I can get away with just using a couple of Tegaderms. Sometimes I need 3, depending on how the setup is. I already had one prepped here. The important part is making sure that your needles cannot snag on anything. Again, That's what it looks like when it's done. And now for your lovely device. Now this is your Freedom 60. I don't know, it's kind of hard to see. Oh, there we go. And it's real simple. You just, it has a winder, you wind it back, you flip it on, and that little thing goes down. Always test it before you use it. Numbers up. And it's got a nifty little, it just matches, but you always have the numbers up because I'll show you why in a second. Well, one, it's easier to read even in the machine. Nice carrying handle. Do the honors. I'm never ready for this part. Oh, don't forget to unlock. So otherwise, you're going to be uneven. You have a carrying case, and it has a little window in it. And this goes in. Window, you can see your numbers. Let's see, actually show you this a little better. Yes, I lose hair all the time and it attaches to everything. Alright, and we are started. Now, in about an hour or so, I'll need to switch out. And I'll show you that and the ending part. After you've got it all the way back, it's just a quick push. Yeah, it slides just a little bit, pop it out. You get your other bottle ready as we normally do. Now, I always wait until it's time. You can prepare it just a little bit in advance to give it a chance to settle the bubbles. You don't want to leave it sitting out too long. Usually your doctor will prescribe that within 2 to 3 hours you have to have it infused of starting the first. Again, sanitary. Same process we did before. Now, I like to loosen this blue cap when I'm doing this because, I don't know, for some reason it just seems to go in a little easier. Oh, when these are shipped to you, they have cold packs. Leave it out to warm up. You don't have to store them in the fridge. They just ship them that way because shipping containers can get really hot. You do not want to infuse these cold. It is very uncomfortable. It's not painful, it's just uncomfortable. Again, we're just slowly pulling it out. Now this thing here automatically allows air in, so you don't have to push air back in. I didn't mention that prior. Lovely bubbles going out. So fun. And again, there's little holes at the tip of that. They go down almost to the bottom of the tip. And you want to get that as close to the gray as possible to get as much of this medicine as you can. Because also some of it stays in the tubes when you're done infusing. And it's okay to get a little bit of air because, again, you'll be pushing that out. Now, need my Kleenex, which it vanished. Now, usually when you get to the part where you're infusing, you can put this folded in half over what's existing so no dust gets on anything. Ash, would you mind getting me a Kleenex, please? Because mine vanished. Now you can tap it just like regular. It just takes a little longer because it is thicker. You want to catch the bubbles because you don't want, if you can avoid it, try not to get it in here. It does get sticky and it does make it difficult to unattach from here. I'll lay it. There is still fluid in here, so okay. So got the Kleenex. Now, like I said, the little bubbles, they usually break up and are ultra fine. The physician, the pharmacist will tell you that it can cause irritation if you have too many big bubbles in there, but it does break up. And I clean because I did get a little bit. Sometimes it's easy for it to keep going even when you've stopped pushing or you accidentally push too much. That's okay, it happens. And of course, we're loading again. And off we go. And then when this is empty, we'll take out the needles. Now, part of the reason I'm doing the taking out part, because yeah, needles are pretty easy to take out. However, one thing they don't tell you when you're removing your needles is to firmly hold down on the butterfly part while you're removing stuff. Because otherwise your needles will come out wrong and it does not feel very pleasant. So with that being said, always also have a Kleenex in handy for this as well, because there are times that you can leak if your needle's the wrong size or any other thing, because my needles are the right size, but occasionally, even with all my prepping, I still get the wrong spot and I still manage to leak. I also make sure that bandages are ready. In my case, I use Tagaderm at the end because of the fact that it seals my skin a little bit easier, and I do not leak as much because I have somewhat of a problem sealing up after I've had my stuff. Now, also, if you find blood in your tubing when you're done, don't panic. It just means you've nicked a small vein. You still will get a vein no matter how hard you try, because there's so many tiny vessels. Just be prepared for a little bit of blood. Again, that's why we have a Kleenex or whatever handy. And even in this part, you do want to have a sanitary hands and everything, because, you know, open wounds. You take it out. The butterflies do close and look like this in the end. You'll cut those off. They give you a sharps container. I usually cut it off right about there. It saves room. You don't have to get new ones as often. It's less of a hassle because you have to package it a certain way to send it back and sign paperwork, and It's just easier to not have to do that as often with all the stuff you already have to do. Much less of a headache. Make sure that your cord is completely free, because that will inhibit you being able to pull the needle out properly. One of the things that I find very trying is getting the cord out of the tegaderm, but it does help to make sure that it's all the way out, so you do not have as much of a response. And that one was definitely a little bit of a mess. When you're using, if you happen to have the same situation as me and you're having to use Tegaderm, make sure your skin is completely dry and anything that might be seeping, whether it be some of the medicine or blood, is completely dry as before you put the Tegaderm on it, or it will not seal properly. It'll leave a pouch and then it'll just go from there, and try and make the Tegaderm as smooth as possible. Do keep an eye on it if you know you're having a bad leakage, because even with the Tegaderm or any bandage, you can soak through. I've actually went through bandages and clothing. So always keep clothing nearby. And definitely keep an eye on your sites and all your connections with your throughout your infusion to make sure nothing's leaking badly. With that, nurses will walk you through, and a lot of times they'll stay with you as long as you need while you're first learning. You do get your own pattern. Typically I do this with my little sister. We have a tag team. We get it all set up and started within like 10 minutes. When I have to do it on my own, like today, I'm not feeling the greatest. I do believe my kidneys are messing with me. I'll do it at home, and it takes a little bit longer even with my kids' help. But do what feels comfortable. You can walk with this in. You can take walks. You can cook. Keep the tubing away from the flames. I've always been really careful with that. Make sure that if you have small ones that are going to be around during it, that they know which side the needles are on, or where the needles are. Now you can, in this part of the arm, on your thighs, on the side or top, wherever there's flesh, you just have to use a smaller needle. You can infuse. I do not choose to, because for me that's just too much pressure in the areas. I was suggested that I do maybe arm and leg at the same time. I've been too nervous to try that. It's all what you're comfortable with. This is not an easy process. Some days you're going to feel bright as everything, and some days you're not going to want to do anything. You're going to be sore. Afterwards, I typically use a heating pad. It helps the medicine absorb. I usually use it for a couple of days on a regular basis. Help the medicine absorb, help the pain and the tension. If you keep at it, even in the darkest days, even when you feel like the best way to describe some of the side effects, except for losing your hair, is you've done a round with chemo. You feel tired, you're nauseous, you don't feel like eating, you're just worn, you just don't feel like you. But I promise you, if this is the right treatment for you, if this is what will work, if you see through the rough parts, like me, I was at a lower dose and it didn't work the greatest. But once I got to the higher dose, I have fewer infections. If I do get an infection, it doesn't last as long. I don't need as much treatment. I can breathe better. My asthma's better. There's so many things that have improved in my life because of this. I can actually keep my nails long. They're not as brittle as they were before. There are so many benefits that outweigh the hard times. And it's a walk. Have somebody there with you. Even if you do it on your own, make sure you have somebody you can talk to, that you can lean on if need be. Because even though this is not cancer, even though this is just an immunodeficiency, it's still serious. It's still very hard to walk through. There isn't a day that goes by that I don't feel worthless at one point or another, because I'm too weak or I don't feel the greatest. And, you know, usually on the good days, that's just when I push myself way too far. But on the bad days, it's harder to get through. But I know in the end that there is light, because before this, I was getting abscesses easily, and they were big and they were horrid, and I was having to get cut open, and it didn't matter how clean I kept myself, I would get them. I mean, granted, most of them were caused by spider bites, but my body couldn't fight any sort of infection. I was getting bladder and kidney infections left and right. I was getting lung infections. My pleurisy was worse. It's worth the battle. I'm hoping that whoever is on this medication, that it's right for you too. I can promise you that if it is what's right for you, that even the bad times are worth the end result. I've been on this since May of last year, and I have come so far. I'm still battling a lot of health issues, and I will be for the rest of my life. A lot of it is genetic and hereditary. I'm sorry, yeah, that's the same thing. A lot of it was there since I was born, just never noticed. But I am fighting, and I'm going to be brave enough to share my story, not just my infusions. I'm going to share my story. I need to, because I have battled so many doctors that didn't want to see me for who I was and the battle I was facing. I was either too young and wasting insurance money, and it was insurance we paid a lot for. It wasn't government funded. It was out of my then husband's check. And the doctor didn't want to waste their money doing a test. And the things that he was supposed to be testing for, I was diagnosed with years later by somebody who actually did take the time. And this journey needs to be shared, because my battle isn't the only one that's like this, but it can help so many that need that help. So until next time, stay safe, stay healthy, and don't let it drag you down.